person who we're going to see today is a gentleman who's had elbow pain for a number of months, unrelieved by conservative care. The patient's had physical therapy, anti-inflammatory medications, has had shot of cortisone. Symptoms continue. The patient's anxious to get back to functionality. This person is going to have his blood drawn, back 60 cc's, as I've mentioned. The blood will be put into a centrifuge, which you'll see. The centrifuge will reduce it down to approximately 2 cc's of fluid, which is a platelet concentrate. And I will demonstrate during today's exam the ultrasound of his common extensor tendon. And we will see, using the ultrasound, the injection of this platelet-rich concentrate directly into the common extensor tendon region. How are you doing today, Mr. Davis?
I'm good. I still have my high level of pain. It's
Okay.
constant. Any movement I make with the elbow, up, down, in, out, continually, even at night, lying in bed. If my arm is in a still position for a long period of time and then I go to move it and it's even worse.
Cortisone shot help?
Not at all.
Okay.
And that was about almost 3 months ago.
Gave you some relief temporarily, no?
Extreme minimal.
Okay. And physical therapy?
I've been taking physical therapy for at least 2 months. Feels good when you're in the, when you're doing it, but when you leave the premise, it's like you never had it at all.
Okay. So today what we're going to be doing is we're going to be drawing blood from you. We're going to be concentrating it on our machine here, and then we're going to be re-injecting it with the use of the ultrasound to guide us into exactly where we need to go. The major risks and complications are infection from any time you have a needle stick. You'll have some pain for the first 24 to 48 hours that can be uncomfortable, and I'll leave you a painkiller. You will have some discomfort over the next week or two, which should be improving significantly as each day goes by. The other complications, anytime you give an injection, could be a reaction to the product, but since it's your own blood that we're giving you back, the chance of any sort of untoward complication is minimized. But mostly it is discomfort. There's always the possibility of nerve damage or tendon damage with the use of an injection. But again, with the use of ultrasound and knowing the anatomy, I find this to be of minimal risk, but you need to know about it. Is there any questions I can answer for you?
Most of them are answered, but I should feel significant relief, but only after 4 to 6 weeks, perhaps?
You will be getting a slow and progressive improvement if this works. And as I described to most patients, they improve, then they'll have a setback. They improve more, and then they may have a setback. The setbacks are when you think you're doing fine and you go ahead and overuse the tendon before it's ready. The full process takes anywhere from 6 months to a year to occur, but it's the first 3 or 4 months that are most critical in allowing this tendon to reconstitute itself to take your stresses of activities of daily living. Okay?
And since it was only a partial tear, the likelihood that one injection may be sufficient as opposed to a full tear that could be
in general,
3
that's,
or 6 or
yeah,
whatever.
in general, that's been my experience. So what we're going to do now is we're going to obtain some blood. Place a tourniquet on you. And I'm going to ask you to squeeze your arm and pump it up. And I want you just to lean back a little and just try to relax. Thank you. And if any time you're having a problem, please let me know.
Mm-hmm.
Just let your arm hang down.
Open my fist.
You can just try to relax. Coming?
Yep. Beautiful. We're all set.
All right, sir, just try to relax for a moment. Pull back, pull back, pull back, pull back. Here you go.
Thank you.
Okay, so that was 60 cc's of blood that we've obtained, and it is now going to our centrifuge to concentrate the blood and to get the platelets that we're looking for. and you can just relax.
Okay.
And that's it for now.
Good.
All right? So Nick, why don't you explain what you're doing?
Of course. Right now I'm taking 60 cc's of blood. We're attaching it to our centrifuge. We already have a 10 cc empty syringe, which is here, that will collect the platelets. We're going to close over the cover. We're going to set our desired amount of platelets that we like, which is going to be 3 milliliters. For this case, it's a very small elbow, small tendon. We're going to press play. The cycle will take anywhere from 11 to 15 minutes, depending upon the amount of blood that we put in. This one probably will take right around 15 or 16 minutes. When we're all finished, you'll see right now, from this syringe, the blood will now go into the centrifuge and start to spin it through. This is our loading phase. After it's done loading, what's going to happen is it's going to take some of the red blood cells out and continually spin the blood down until we have just the platelets left in our centrifuge. After that, after the full 15 minutes is up, the processing will happen and it'll be put right into the syringe ready to inject. And that's
Thank you.
really it.
Thank you. Okay. All right. Okay, there it is.
See it right there.
Yep. So here we have the radial head of the elbow. This is the distal humerus, and right here is the common extensor tendon of the elbow. If you will notice, there's some dark spots right within the common extensor tendon, and these dark spots right in here are the degenerative changes within the tendon themselves. So this is the area of the common extensor tendon that we'll be aiming for in order to get our platelet-rich protein right into the pathology. So again, radial head, elbow joint, distal humerus, lateral epicondyle, and the common extensor tendon with the degenerative tendinosis seen within the tendon itself. Okay?
In the 60 milliliter blood draw, we get 3 milliliters worth of platelet-rich plasma, which now we'll inject into the site like Doctor just explained. We remove it, add a needle to it, close this off, and the process is over.
Okay, so there's our tendon. Okay. Now, you're going to feel a stick. You see the needle, you see that line on top? You can actually see the needle tracking down, and you can hit the color Doppler right now, and you're going to see the fluid going in through the needle, and you'll see the Doppler of the fluid. Now I'm going to go a little further down, and now you see the fluid actually going right into where the tendon is. And you're going to feel some discomfort, sir. I'm sorry. That is, as it goes in, done. So, that was uncomfortable. I am sorry, but you'll be feeling better. The first 24 to 48 hours after the shot, it can be somewhat painful, or I would call it uncomfortable. That period, they may require pain medicines, they may require icing to the area, and then it calms down. But then they will notice the feeling that they've gone through a workout, in the sense that they'll have some discomfort in the area. That discomfort will, for the most part, decrease significantly over the first week. Again, this is all by design. We're trying to start this inflammatory process off by creating these growth factors and releasing them into the area. In the beginning, again, I don't think physical therapy is very helpful immediately. I would say physical therapy would be more helpful a few weeks down the road in those areas to, again, get motion, maintain motion, and slowly begin to strengthen. But again, the emphasis on slowly. We have a tendon here that is healing, and just picture it. I would ask the therapist to think of it as the way you think of any other tendon that had undergone a surgical repair. What do I do with my rotator cuffs? I do passive range of motion for the first 4 weeks just to make sure they don't get arthrofibrosis. By the way, all my rotator cuff repairs get platelet-rich protein intraoperatively. I do that the same reason I do it for the elbows or anywhere else. I'm trying to encourage tendon healing. I have found by using this platelet-rich protein in my shoulders, whether it's for a repair or even a simple decompression, I have found my patients regain their range of motion quicker than they did prior to my using this platelet-rich protein. The rotator cuff repairs I have found, again, move quicker, have less discomfort. This is somewhat anecdotal. I don't have studies to back it up. I believe studies will be coming along to reinforce this. But that has been my personal experience, and I do a great deal of work on shoulders. Again, for a physical therapist, if you picture it as a tendon repair, and you think of it as a tendon repair, you know the goals are, number one, maintain range of motion, don't overstress the tendon repair, and as time allows and the tendon heals, then you can begin the active assisted and eventually the active range of motion with resistance and strengthening. But as you know, with any tendon repair, it takes a few weeks to months for that to occur. I have worked with runners. I've worked with athletes that are basketball players, runners. I've dealt with a couple of cases of jumpers' knees, which is basically a chronic patellar tendinopathy. I've injected them, and lo and behold, they have gotten better. In terms of the Achilles tendon, there's a number of different procedures depending on if it is a tendinopathy of the tendon itself, which would benefit from the platelet-rich protein, versus the paratenon and inflammation of the paratenon, where you'll have the fusiform swelling and an MRI just showing swelling of the paratenon versus a tendinopathy of the tendon itself. If it's a tendinopathy, we would use the PRP. If it is the paratenon that is inflamed, there are prolotype therapy type modalities with the use of dextrose and lidocaine injection blocks that can be very helpful in those patients. I could tell you a number of recent successes. The one who came in this morning is a gentleman who had tennis elbow for over a year and a half. He had multiple shots of cortisone into his elbow. He would rest it. He would do fine with the shot. He'd see me a month later. He was happy. He'd come back 3 or 4 months later and saying, well, I picked up a saw, or I went to start a lawnmower, and lo and behold, it came back again. The classic signs and symptoms: taking the milk out of the refrigerator in the morning and having the pain, picking things up, trying to hammer with a hammer, trying to play tennis or use any racket sport where you're bringing your wrist back quickly would increase the symptomatology. I gave him a shot of PRP 4 weeks ago. He came in today. He was essentially asymptomatic. He had no tenderness. He said he had mild discomfort on use of his elbow. I cautioned him that he was by no means healed yet. I cautioned him that he was on his way to healing, and if he was to overstimulate his body at this time, and especially these tendons, he would most likely develop his symptoms and it would worsen. So it takes 4 to 6 months for this process to come around, and maybe even a full year. But the first 4 to 6 months being the most critical, that while they are healing, they must take care of it with the appropriate stretching and protection to allow the tendon to heal. Another example would be a gentleman who had a hamstring injury. He was unable to bend down more than perhaps 3/4 of the way down to touch his toes. He had an MRI showing a tear between the junction of his muscle and tendons. And despite physical therapy for a number of months, the use of anti-inflammatory pills, he continued to be asymptomatic. I localized the tear on ultrasound. I gave him an injection of PRP into it. He came back 4 weeks later. He was able to bend down, put his hands on the floor, touch the floor without any problems, with his knees completely straight. He told me he was completely asymptomatic. And quite honestly, I was amazed at the result.